Hi, I'm Daniel Tuerff. I'm a second-year fellow at the University of Miami. I'm joined here by Dr. Hornstein. Go ahead and introduce yourself.
Hi, my name is Nick Hornstein. I'm a GI medical oncologist at Norfolk Health. I'm looking forward to chatting about Breakwater, I think.
Yeah. So we're here to talk about the Breakwater trial, a trial in metastatic colorectal cancer that is BRAF V600E mutated. And so I want to ask about some of the updated data we're getting here at ASCO GI. How is this changing our current strategies in BRAF mutated metastatic colorectal cancer?
Yeah, so the Breakwater trial was actually an assembly of a number of different arms, many of which are not really impacting clinical practice so much. So we had the EC alone encorafenib cetuximab arm, and then we had the Fulfox encorafenib cetuximab arm. And that is the mainstay of the Breakwater trial, and what we're using in clinical practice today. I think tomorrow we're going to be hearing a little bit about Fulfuri in addition to EncoCitux, which was an additional arm that was incorporated into the study. So at the end of the day, I'm not sure if it's really going to change many providers' practice patterns because they should be offering the Breakwater combination of Fulfox, EncoCitux as the first-line standard of care therapy for BRAF V600-Mutated colorectal cancer.
Yeah. And you mentioned, we're potentially hearing some updated data on Fulfuri as well. How does this, potentially affect second-line treatment in these BRAF mutated?
That's going to be a very good question. We have to wait for the presentation tomorrow to really suss things out. I think that we'll be able to see, at least in the first line, how Fulfuri is incorporated into the treatment paradigm. In terms of the second line after EncoCitux, Fulfox, it's a little bit hard to say exactly what we're going to be using as our best approach. Yeah, we'll see what the presentation looks like.
Yeah. And, I'm also curious if there may be a role for rechallenge or even maybe maintenance for encorafenib cetuximab.
Yeah, so that maintenance question is fantastic. So if we look at the Breakwater trial, I think one of the things a lot of people are worried about is the development of peripheral neuropathy. And if you really simply look at the number of patients that developed it in the control arm, which is chemotherapy alone, versus the EncoCitux chemotherapy arm, it looks like EncoCitux chemotherapy is really causing a lot more neuropathy. But if you suss a little bit more into details, you see that the patients that are on the EncoCitux arm, they're doing better, they're on treatment longer, and they're exposed to more oxaliplatin. And you and I both know that the development of neuropathy is directly related to how much oxaliplatin you're receiving.
Right.
So it makes sense that if you're doing really well, you're probably going to stay on treatment longer and you might develop some neuropathy.
Yeah.
So I think that at the end of the day, it's really about maintenance.
Right.
So what I'm doing in practice, what a lot of other people are doing, and remember, this is not the way this trial was designed or FDA approved, but we're moving into maintenance. So we're giving 5-FU EncoCitux and we're dropping the oxaliplatin. And by doing that, not seeing much neuropathy now.
Great. Well, awesome. And then, any other updates you might be excited to hear about tomorrow?
So last year was really the year of colorectal cancer. I think going from ASCO GI to ASCO to ESMO, every presentation was colon. And there were these huge practice-changing talks that were coming out. And I mean, Breakwater comes out. Who would have thought that over 2-year survival for metastatic BRAF V600E colon cancer was possible? I certainly didn't.
Yeah.
That's changed the face of the disease. So tomorrow, I think we're going to see some refinement. We'll see some advances. We'll get a little bit of new knowledge. But in terms of absolute practice-changing things, we don't have Stellar 303 presenting for the first time tomorrow, right? So we'll see. I think there's some interesting data that is going to affect practice, but it's not going to completely redefine the landscape. But really excited to tune in and see how it's doing.
Awesome. Well, thank you so much.
Yeah.
Good to talk to you.
Good talking to you.
All right.